Hello, this is mental health student 22 and today I am talking about schizoaffective disorder. I wanted to add 3 things from my 2 last videos. First of all, Abilify aripiprazole is considered as an atypical antipsychotic, which I didn't mention since it binds to the serotonergic receptors. Furthermore, Abilify is approved, if I'm not mistaken, by the FDA, or at least used as an adjunctive treatment of MDD, major depressive disorder. Finally, clozapine is extremely sedative, which I mentioned, but I wanted to add that even quetiapine, Seroquel, is considered as only moderately sedative compared to it, so you can imagine if you take these medications. I often hear about people suffering from schizoaffective disorder. Oh, I suffer both from schizophrenia and from bipolar disorder, but how is this possible? Well, we notice that psychological disorders should be approached by a dimensional approach and not by a categorical approach, meaning that we noticed that psychological disorders tend to be put on a spectrum, even though the DSM-5 still mostly uses a categorical approach of mental disorders. In this sense, sometimes we notice that schizophrenia and bipolar disorder can overlap, and this is where we get schizoaffective disorder. Criterion A, or the first criterion for schizoaffective disorder, is according to the DSM-5, which is the last edition of the Diagnostic and Statistical Manual of Mental Disorder, edited by the APA, American Psychiatric Association, an uninterrupted period of the illness where there's both a major episode of mood trouble and the criterion A of schizophrenia. So, a major mood episode concurrent with the criterion A of schizophrenia. The major mood episode can be either manic or depressive. If depressive, it must include the criterion A1 for MDD, major depressive disorder, which is depressed mood, which is not present in all cases of MDD, and the criterion A of schizophrenia must include 2 or more of the following: hallucinations, delusions, disorganized speech, disorganized behavior or catatonia, negative symptoms. Please note that one symptom at least of schizophrenia must be one of the 3 first symptoms of criterion A to reach it. Criterion B, or the second criterion of schizoaffective disorder, is extremely important because It is what is going to make the difference between schizoaffective disorder and bipolar disorder, which was not so clear in the last DSM. And that was why, because we diagnosed so much people with schizoaffective disorder. To suffer from schizoaffective disorder, you have to have a psychotic episode for at least 2 weeks, actually hallucinations or delusions constantly for at least 2 weeks without having any mood troubles during the lifetime duration of the illness, which will not happen in a bipolar disorder, whether it is type 1 or type 2. Because in bipolar disorder with psychotic features, we know that the psychotic features are caused by the mood trouble. Criterion C, the first criterion, is that the symptoms of the major mood trouble must be present for the most duration of the illness, whether it be in the residual or in the acute portions of the illness, meaning whether it is in the acute or in the non-acute portions of the illness. So there must be a consistent major mood episode during the whole duration of the disorder to be diagnosed with schizoaffective disorder. Criterion D, which is the last criterion of schizoaffective disorder, is that any of the symptoms must not be due to drug use or to any substance, nor to any other medical condition like brain tumors. Finally, there are some specifications. Well, yes, when you think of it, the major trouble of mood can be either manic or depressive in the diagnosis. So, there are two types of schizoaffective disorder. The first type, if there are only major depressive episodes during the illness, we say and we specify schizoaffective disorder depressive type. On the contrary, if there's at least one manic episode, whether or not there are concurrently to it depressive episodes, we specify schizoaffective disorder manic type. We must also specify if there is catatonia, which is the third symptom in the criterion A of schizophrenia. So we would say, for instance, schizoaffective disorder manic type with catatonia, or schizoaffective disorder depressive type with catatonia. So after all that, if we reach the 4 criteria, we are diagnosed with schizoaffective disorder. But is it really suffering from both schizophrenia and bipolar disorder? Well, technically, no. because criterion D of schizophrenia notably mentions that the patient should not suffer from schizoaffective disorder to be diagnosed with schizophrenia. But to make it very, very simple, we could say that bipolar disorder and schizophrenia kind of overlap to form schizoaffective disorder. But once again, some people suffering from schizoaffective disorder would not meet all the criteria for schizophrenia, even if it didn't say that patients shouldn't suffer from schizoaffective disorder. And some patients would not reach all the symptoms, all the criteria for bipolar disorder, even though some patients would meet both bipolar disorder criteria and schizophrenic criteria if there wasn't that criterion saying that we should not suffer from schizoaffective disorder to be diagnosed with schizophrenia. I'll let you think about that. Thank you for watching.